Are lockdowns helpful or harmful? After months of some of the strictest lockdown policies, Chicago's mayor and New York's governor are shifting their message to say we must open up. NTD's Christina Kim speaks to a Stanford University professor on lockdown policies.
Mixed messaging from the media, government, and public health officials have confused people on whether or not lockdowns are actually helpful. We speak to Dr. Bhattacharya, a professor at Stanford University Medical School, a physician, health economist, and public health policy expert focusing on infectious diseases and vulnerable populations. Calling the lockdowns a failure of imagination in public health policy, Professor Bhattacharya says we must begin to reopen our economy in a safe way.
The lockdowns are a failure of imagination in public health policy, and it's led to catastrophic damage both domestically and worldwide. I think we're going to be counting these costs for a long time.
Bhattacharya recently co-authored a peer-reviewed study that compared virus cases in countries with strict lockdown policies like Italy, Germany, and England with countries with looser restrictions like South Korea and Sweden. The study showed draconian lockdown measures have no significant benefit. Bhattacharya says it isn't anyone's fault lockdowns aren't fully effective, since working-class people and essential workers can't afford to stay home indefinitely.
The lockdowns have protected the rich. They protected people who can afford to work from home with no loss of income. They have not protected everybody else. So I think it's not surprising, this result. Inevitably, the lockdowns will fail just because we aren't rats to be put in cages that can stay there forever.
He says the lockdowns have devastated people's trust in public health because they seemed arbitrary and health officials gave contradictory advice. Bhattacharya encourages using public health messaging to tell people to socially distance and put resources toward vulnerable populations. He notes the pandemic has been enormously politicized and that the treatment of vulnerable populations like the elderly and those with pre-existing conditions should be based on science, not politics. The professor said he's witnessed censorship in the scientific community when discussing the pandemic.
There's this sort of spirit of censorship within the scientific community for people who don't agree with the majority view that is absolutely terrible for science.
For science to continue, he says people must not demonize those with differing views and should instead return to open scientific discussion. Bhattacharya says, moving forward, public policies must protect the vulnerable, open schools, and start to lift the lockdowns safely. Christina Kim, NTD News.